Hospitals are already facing a surge in patients with the Delta variant of COVID-19. Now there's a new unrelated outbreak. The CDC reports that new evidence of an untreatable fungus spreading in a few hospitals and nursing homes. A superbug outbreak is reported in a Washington, D.C. nursing home and 2 Dallas area hospitals. 3 patients have died. The fungus, which is spread through patient contact or on contaminated surfaces, can be deadly when it enters the bloodstream, heart.
Now to that CDC warning of an outbreak of a superbug fungus attacking people here in D.C. and in Texas. And to make it worse, the fungus is tough to treat. We get more on this from CBS's Omar Villafranca.
Tonight, the CDC is keeping tabs on more cases of a drug-resistant fungus that is spread in healthcare settings. It's called Candida auris. 2 new clusters of the superbug were reported by the CDC. 22 cases were in 2 Dallas area hospitals, leaving 2 people dead. 101 cases were reported at a Washington, D.C. area nursing home, killing 1 person. Dr. Floyd Wormley of Texas Christian University has studied the fungus and those most at risk.
So if you're in a hospital, you have a severely weakened immune system, and you are undergoing certain treatments or therapies in which this organism can gain access into your body, then it can cause issues.
The CDC's Dr. Megan Lyman says patients being treated for COVID are vulnerable.
There's a lot of patients that had COVID who acquired Candida auris, and in general, Candida auris is more likely among patients who are at long-term care facilities, who are chronically very sick, have invasive devices like tracheostomies, or are on a ventilator.
Researchers have found that the fungus can not only be contracted from surfaces, but can also be spread person to person, which is what appears to have happened in these recent cases. Dr. Wormley is part of a team that's working with the National Institutes of Health to fight the superbug, and he thinks there's potential for an effective treatment in 2 to 3 years. Nora?
Omar Villafranca, thank you.
Tonight, the CDC says it has evidence of a dangerous fungus that in some cases is untreatable. Nothing more than that. It is linked to 2 deaths, in fact, and 2 North Texas hospitals have seen the fungus spread. Our Brooke Katz's looking into it tonight for us. She's in the CBS DFW studio with some more information on this. What do you know, Brooke?
And Doug, the cases were first seen back in January. The CDC told the Associated Press the outbreak is ongoing and additional infections have been identified since April.
The fungus, Candida auris, was identified in a cluster of 22 patients in 2 Dallas area hospitals. Health officials have not released the names of the facilities. Candida is a yeast that can cause infection if it gets into parts of the body where it doesn't belong, like the bloodstream, heart, or brain. It's usually treated with antifungal medicine, but experts say widespread overuse of those medications created Candida auris. It's known to spread quickly from room to room on people and clothing. It's something health officials have been concerned about for years. Back in 2019, specialists with the CDC started calling for stronger measures to detect and prevent these sorts of infections.
It has the unfortunate capacity of being very, very resistant to some of our antifungals, and it also has a capacity to contaminate the environment and persist in the environment. So it's kind of a double whammy in the infection control world.
Of the 22 Texas patients, 2 appeared to be fully resistant to treatment. Both patients died. They are the first cases of the kind in the state. The CDC's website says cases of Candida auris have been increasing during the pandemic, with outbreaks reported in COVID-19 units of acute care hospitals. They say the outbreaks could be related to changes in routine infection control practices.
The CDC says people who get serious infections are usually already sick and hospitalized with other conditions. More than 1 in 3 patients with Candida auris die. Experts recommend you don't be afraid to ask a hospital about their infection control protocols. And most importantly, keep your eyes open and make sure personnel wash their hands each time they enter the room or touch objects that could be contaminated. Doug?
Always makes sense to be your own best advocate when you can. Thank you, Brooke.
There's still many questions health officials have not answered about the spread of this fungus, but here's what we know at this point.
The biggest risk is in persons, who have underlying health conditions and are, in healthcare facilities.
There were 2 people who died in Texas from this fungus known as Candida auris, as they were resistant to the treatments. The CDC says between May 1st of 2020 and April 30th of this year, there were 13 cases in Texas. So far this year, those 2 died. So how is this spread? I spoke with an associate provost for research at TCU.
This organism can be on our person. We can be carriers of Candida auris. And so, for example, if you are a normal, healthy person and you come in contact with this, it causes no problems. You really don't have to worry about it. However, you can be a carrier. You can carry it into the hospitals. You can carry it when you are if you are a physician or a nurse working with a patient. You can contaminate these surfaces in the hospital. Your everyday healthy person should not be overly concerned. However, if you are a healthcare professional, healthcare provider, and you think that you might be a carrier, you might want to take the steps to be sure that you are maybe wearing gowns, wearing gloves, or properly washing your hands when you're in that environment so that you don't potentially spread it or infect other susceptible people.
We have asked local leaders about what healthcare facilities have reported cases. So far, we do not have those answers. We do know there are 0 cases in Dallas County, but the state did work with Collin County Healthcare Services. I have asked local, state, and federal healthcare officials about the current number of cases in Texas. How many cases do we have right now? So far, we have not heard back. In Dallas, I'm Alex Rozier.